Hello, my name is Dr. Fruitman. I'm a board-certified psychiatrist, and I'm a medical director of Trifecta Health. We specialize in treatment of adult attention deficit disorder. It came to my attention lately that with advent of new system by which in New York State all the prescriptions for stimulants are being tracked by a single source, a lot of the patients have been found to be visiting more than one doctor for stimulant prescriptions. So I found some patients who go for an Adderall prescription of 30 milligrams to one doctor and 20 milligrams to another doctor and 10 milligrams to a third doctor. Most of the patients I've seen who are overusing stimulants or using stimulants at a much higher than recommended dose are not doing it because they're drug addicts. They're not seeking to have fun or pleasure with this behavior. Most commonly, patients who overuse amphetamines and stimulants such as Adderall and Ritalin do it so that they can function better. Sometimes people are prescribed maximum dose, like 60 milligrams of Adderall, and it works for a while. Then after a stressful day at work or two, people attempt to take a little more and then take a little more, and gradually to build themselves up to quite a high dose. Of course, this behavior is not sustainable, and all such patients have to somehow come to a more reasonable or recommended dosing range. So the question comes, what to do next? At Trifecta, we can help a patient who is using stimulants in over maximum dose range develop a system, develop a strategy. So what we can suggest is a couple of things. One of them is come for an evaluation and be honest about exactly how much stimulants you're taking. We start by doing a genetic test. It's a simple analysis of saliva that is covered by most major insurance companies, and what the test shows us is exactly what medications are metabolized very rapidly by your liver. Some patients metabolize medications so rapidly that in fact higher doses of stimulants are recommended for them because whatever they take disappears from their system very quickly. Following the test, we can determine what stimulants are most recommended. One patient is coming off very high doses of Adderall. Let's say a patient takes 120 milligrams or 150 milligrams of Adderall. When they take FDA-approved 60 milligrams a day, they report feeling drowsy, feeling sluggish, feeling like they're swimming in jello and can barely move and think. So what we do first is use a combination of medications that makes using smaller dose of Adderall more reasonable. We use Nuvigil or Provigil to make sure that a patient is more awake in the morning. We can use Deplin or other prescription vitamins to make sure that a patient restores their brain and the brain is no longer depleted by amphetamine use. We can use other medications like either Pristique or Wellbutrin to help restore the dopamine balance in the brain. And some patients really require Topomax at night also to restore dopamine balance in the brain. This can all be brought under control. In rare cases where reduction in dose is not effective at all, we can recommend combining medications with transcranial magnetic stimulation, which is a way to magnetically stimulate the centers of the brain that are involved in attention and concentration and mood in order to prevent depression and to restore ability to think and work. Come to Trifecta for a consultation. We are not going to judge you harshly. We understand that the reason why you overused amphetamines and have gotten multiple prescriptions from multiple providers was so that you can work and function, succeed, take care of your needs and your family's needs. And we don't pass a moral judgment in that. We just want to help you restore yourself to where you should be.